Hi, I'm Lauri Kane from the Plastic Surgery Office of Dr. Dean Kane in Baltimore, Maryland. A lot of people want to come in for fillers. A lot of people don't really understand that there is an array of types of fillers for very specific purposes. So the filler companies have really gotten very specific in where each filler can be used, and they're FDA approved actually for those areas. So let's walk you through all the different fillers that we actually use here with Dr. Kane. And Dr. Kane is the injector here. He's an expert injector. There are other places that use a nurse injector, but in our case, Dr. Kane would be the person who would be doing your fillers for you. And when you have a plastic surgeon doing the injections for you, it's going to be a very different technique because he does facelifts all the time. So he knows exactly where the muscles and all the different layers of the face and the skin is. So you're kind of getting a very unique experience when you have Dr. Kane do your fillers for you. Let's walk you through this. So fillers are actually created with different thicknesses and different thinness. So you have Refine at the bottom here. Refine in the Restylane family, and we do use the Restylane products in our office. Refine is your thinnest filler for fine lines, and we like to use it where you might have fine, thin lines around the mouth area. I like Refine for patients who their lips need kind of a border to them. Like some women's lips go kind of straight into their lip and they don't have this nice edging to their lips. So I like Refine to give a little bit more structure to a lip without oversizing the lip. So Refine is for your fine lines. Then you have Define. Define is really designed as an expression filler. So for example, we mainly use it in the nasal folds here. So when you smile or use expression, it moves with the expression. It's really excellent for the folds here in the nasal folds and also the marionette as well. So Define is really nice used for expression type wrinkles. The next one we use is Kiss. Kiss is, as you would think, is for the lips. What's wonderful about Kiss is that you put filler into the lips and it's immediately natural. Like you don't have to worry about the swelling that you might get from a filler. Women are always coming and saying, I want my lips filled, but I just don't want to look like they were done. I don't want to look overdone. And when they say that to me, Kiss couldn't be the more perfect filler when it comes to the lips. Natural, you walk out of here hardly swollen, and it just is a gorgeous natural fill to the lips. Lift actually is probably our most versatile filler. Lift is our most volumizing filler. So we use Lift in a lot of different places. I particularly love Lift in the cheeks, which is where I had my cheeks done about 3 weeks ago. It's your largest volume, so when you're looking for a good full look, that's where we put in the filler Lift. But those women who want really plump and luscious lips and they want really full lips, we'll use Lift in the lips. We can use Lift in the chin line, and we can use Lift in the temples. So that's kind of our Restylane Lift is our workhorse filler. The next two unique fillers is the newest of all the fillers is RH2. This is not part of the Restylane family. It's by Revance. RH2 is a very unique filler. It is also made for fine lines. What I love about RH2 and what Dr. Kane loves about it is it's designed to be very liquidy, very oil-like or butter-like when it goes into the skin. So when you want to put something into a fine line and you don't want to see you don't want structure to it, you want it to blend into the tissues in a very place where it's fine lines, and you want it to kind of fill the little fine line but also blend without seeing a lumpy, bumpy thing. RH2 is amazing, and the place where we use RH2 the most happens to be in the forehead lines. So where it's very bony and you want it to like spread among a very thin skin, RH2 is the perfect filler. And I actually do RH2 in my 11s here, and even though I use, my Dysport, my Jeuveau, I still crease. I mean, it does crease no matter even if you use your neurotoxin. So I actually do my 11s and my fine lines in my forehead with RH2. And all these fillers actually last for about a year. You get that kind of longevity. Now Radiesse is extremely unique because all of these are hyaluronic acid. They're clear gels. So that's what they have in common here. However, our Radiesse is your most unique filler. It is made out of ground up fine calcium, synthetic calcium, and when you look in the syringe, it looks like Elmer's glue. It's kind of white and opaque like that, and just like has a thick quality about it. And as you can imagine, we're using Radiesse to replace bone. So we use Radiesse for women who want to build up their nose, and like for any reason, they have a divot or they have this low volume here. Radiesse is perfect to put along the bone of the nose to get a reshaping of the nose. The other place we use Radiesse is actually in the cheeks, along the cheekbone. Because it's white, the really wonderful asset about Radiesse is when you put it under in the cheek area and you have some dark hollowness to it, you have dark hollows and you want to lighten it, it becomes like a concealer. So you're getting not only a plumping effect, but you're getting a lightening effect by putting this under the skin. It lightens the skin that you see here, so you don't have those dark hollows any longer. So we love Radiesse. It's a very unique filler, and it's really excellent. All right, these are your options, and now the best thing to do is come in, have a personal evaluation, and we will tell you which of these are going to be best for you. And again, Dr. Kane, you couldn't have a better injector than Dr. Kane. So give us a call, 410-602-3322. Looking forward to seeing you.